Most women expect back pain later in pregnancy when the belly is large and the weight is obvious. What surprises many is that back pain can start within the first few weeks before a bump is even visible. Early pregnancy back pain is real, it is common, and it has specific physical causes that are already happening inside the body from the moment of conception. In this video, I am going to explain exactly why back pain starts so early in pregnancy, what is driving it, and the specific safe steps to get relief right now. Why back pain starts in early pregnancy. Early pregnancy, the first trimester, roughly weeks 1 to 12, is a period of enormous hormonal and physical change. Even though the belly is not yet visible, the body is already preparing for the demands of carrying and delivering a baby, and several of these changes directly affect the spine and pelvis. Number 1. Relaxin hormone loosening the ligaments. Almost immediately after conception, the body begins producing a hormone called relaxin. Its primary job is to loosen the ligaments of the pelvis so they can expand during childbirth. The problem is that relaxin does not affect only the pelvic ligaments, it loosens the ligaments throughout the entire body, including those that stabilize the lumbar spine. When these supportive ligaments become lax, the joints of the lower back lose stability, the surrounding muscles have to work much harder to compensate, and the result is aching, fatigue, and pain, particularly in the lower back and sacral area. This process begins in the first trimester and is often the earliest physical cause of back pain in pregnancy. Number 2. Uterine expansion and round ligament pain. Even in the first trimester, the uterus is growing and expanding to accommodate the developing baby. The round ligaments, which attach the uterus to the groin and pelvic wall, stretch as the uterus enlarges. This stretching causes sharp or cramping pains in the lower abdomen that frequently radiate into the lower back. Round ligament pain is one of the most common complaints in early pregnancy and is often described as a sudden sharp twinge in the groin or lower abdomen that shoots into the back, typically triggered by a sudden movement, coughing, or rolling over in bed. Number 3. Postural changes from fatigue. First trimester fatigue is intense and is driven by the surge of progesterone in the body. When a woman is exhausted, her posture suffers, shoulders slump forward, the lower back rounds, and core engagement drops. This postural collapse places directly increased load on the lumbar spine and the muscles alongside it. A woman who normally carries herself well may find that in early pregnancy, sustained fatigue is causing her to sit and stand in ways that strain her back for hours each day, even before any physical weight has been added. Number 4. Sacroiliac joint irritation. The sacroiliac joints connect the base of the spine to the pelvis on each side. Under the influence of relaxin, these joints become hypermobile, they move more than they should. This excess movement causes inflammation and pain in the SI joints that is felt as a deep aching in the lower back and buttocks, often on one side more than the other. It is frequently worse after prolonged sitting, when walking upstairs, or when standing on one leg. SI joint irritation in early pregnancy is one of the most commonly overlooked causes of first trimester back pain because there is no visible belly to explain it. Number 5. Digestive changes and bloating. Progesterone relaxes the smooth muscle throughout the body, including the muscles of the digestive tract. This slows digestion significantly, leading to bloating, gas, and constipation that are very common in the first trimester. A bloated, gas-filled gut creates pressure that pushes against the back wall of the abdomen, generating a dull, pressure-like ache in the lower back. Many women are surprised to discover that managing their digestion makes a noticeable difference to their early pregnancy back pain. Number 6. Pre-existing back conditions worsening. Women who had any degree of back trouble before becoming pregnant, a previous disc injury, general lower back tightness, or a weak core will often find that these issues become more symptomatic in early pregnancy. The combination of hormonal ligament loosening, reduced exercise due to nausea and fatigue, and postural changes from exhaustion all compound a pre-existing vulnerability in the spine. If you had occasional back pain before pregnancy, and it has worsened significantly in the first trimester. This compounding effect is almost certainly a significant part of the reason. How to tell what is driving your pain? If the pain is a diffuse aching heaviness across the lower back that is worse at the end of the day, and when you are tired, fatigue-related posture and relaxin-driven ligament laxity are the likely drivers. If the pain is a sharp twinge in the groin or lower abdomen that shoots into the back with sudden movements, round ligament pain is the cause. If it is a deep ache, specifically in one or both buttocks and the very base of the spine that worsens with sitting or stairs, the sacroiliac joints are irritated. If the pain is a dull, pressure-like ache that shifts or changes after meals and bowel movements, digestive bloating is involved. Exact solutions. Safe relief for early pregnancy, back pain. Every solution here is safe for the first trimester. Always check with your midwife or doctor before beginning any new exercise if you have a high-risk pregnancy or any complications. Fix 1. Pelvic tilts. This is the most recommended exercise for back pain at every stage of pregnancy, including the first trimester. Stand with your back against a wall. Gently flatten your lower back against the wall by tightening your abdominal muscles and tilting your pelvis slightly upward. Hold for 5 seconds, then release. Do 15 repetitions, twice daily. Pelvic tilts reactivate the deep core muscles that stabilize the spine, reduce the excessive lumbar curve that strains the lower back, and can be done anywhere at any time from week 1 of pregnancy. Fix 2. Gentle cat-cow stretch. And start on all fours with your wrists beneath your shoulders and your knees beneath your hips. Gently arch your lower back upward toward the ceiling, like a cat stretching. Hold for 3 seconds, then lower back to neutral. Do not allow the back to sag downward below neutral. Only work between neutral and the upward arch. Do 15 slow repetitions. This mobilizes the lumbar spine, releases the muscle tension that builds from postural fatigue, and gently encourages the sacroiliac joints to move through their normal range, reducing the stiffness that drives SI joint pain. Fix 3. Hip flexor stretch. The hip flexors tighten quickly in early pregnancy due to the combination of hormonal changes and increased sitting from fatigue. Kneeling on your left knee with your right foot forward, gently push your hips forward until you feel a stretch at the front of the left hip. Keep your torso upright and your core gently engaged. Hold for 30 to 45 seconds per side. Do 3 sets, each side twice daily. Releasing the hip flexors takes the forward pull off the pelvis and directly reduces the lumbar strain that is generating lower back pain. Fix 4. Supportive sleep position. Sleep quality matters enormously in the first trimester, both for rest and for spinal recovery. Sleep on your side with a pillow between your knees to keep the pelvis level and reduce strain on the sacroiliac joints overnight. If you wake up on your back in early pregnancy, it is not dangerous at this stage, but side sleeping with knee support will significantly reduce morning back stiffness. A firm, supportive mattress is important. Sleeping on a surface that sags allows the spine to fall out of alignment for the entire night. Fix 5. Manage bloating and digestion. If digestive pressure is contributing to your back pain, take steps to keep things moving. Drink at least 2 to 2.5 liters of water. Daily constipation in pregnancy is significantly worsened by dehydration. Take short walks after meals to stimulate gut motility. Reduce gas-producing foods such as beans, cabbage, carbonated drinks, and onions. Adding ginger tea and eating smaller, more frequent meals rather than large ones reduces the bloating and pressure that drives digestive back pain in the first trimester. Fix 6. Rest strategically and use heat. First trimester fatigue is genuine and significant. Fighting it entirely will make both the fatigue and the back pain worse. Rest when your body signals it and use short rest periods strategically to prevent the postural collapse that strains the back. Apply a warm, not hot, heating pad to the lower back for 15 minutes at a time to relax the overworked muscles. Alongside the spine, do not apply heat directly to the abdomen. Avoid very hot baths. particularly in the first trimester, but a warm shower with water directed at the lower back provides meaningful muscle relief safely. When to contact your doctor or midwife. Contact your healthcare provider promptly if your back pain is severe and came on suddenly, if it is accompanied by cramping, spotting, or vaginal bleeding, if it comes with fever or pain, during urination, which can indicate a kidney infection, or if the pain is one-sided and intense. Any back pain in early pregnancy that worries you should be assessed. It is always better to get checked than to assume. That is everything exactly why back pain starts so early in pregnancy and the specific safe steps to get real relief in the first trimester. If this video helped you, hit the like button and subscribe for more back pain relief content every week. Leave a comment below telling me how many weeks along you are and where your pain sits. I will reply and point you toward the most relevant solution for your stage. Take care of yourself, and I will see you in the next one.